welcome to the deep dive. You know, how critical is full transparency when it comes to information, especially public health data? It's a question that often kind of lingers, but today we're taking an in-depth look into some pretty significant large-scale findings that really bring it into focus. And when we talk about these findings, a key term you'll probably hear is excess deaths. That just means the number of deaths above what you'd normally expect for a certain time, based on past averages. Getting that baseline is pretty crucial for our chat today.
That's right. Our mission in this deep dive is really to unpack this new publicly compiled data from Japan. It's looking at potential long-term effects of the COVID mRNA vaccines. We'll, dig into what these findings might reveal, explore the nuances, and look at the broader implications, especially around data availability and, well, how the public gets to understand this kind of critical info.
Okay. And for this deep dive, our main source is a video from Dr. John Campbell's YouTube channel. He goes through information presented by a team of Japanese experts. There's a scientist, a journalist, and a politician involved. And what makes this compelling is it's all apparently based on a huge data set. We're talking about roughly 18 million people in Japan.
Yeah, let's start with where this information actually comes from. The key people behind this data are part of Japan's information disclosure request team. You mentioned the scientist, Dr. Murami, sometimes called Morici in early reports. He's a senior fellow in molecular oncology and pharmacology. And he's working with a journalist and a politician, like you said.
That's quite a mix on the team. And the scale of the data set they pulled together is just massive, isn't it? Information on vaccinations for about 18 million people. Now, given the source material is mainly a video of, a roundtable discussion, some written notes, not a formal paper yet.
Yeah.
How should we think about this information?
That's a really good point. Look, a full peer-reviewed paper isn't out in the traditional sense, not yet anyway, but the insights are coming from direct disclosures and this massive data compilation. The source mentions AI translations were used, but importantly, they were checked by Japanese speakers. That helps with accuracy, And honestly, with 18 million people, the sheer volume makes the observed patterns pretty robust, even if it's not presented like a typical journal article right now. That large sample size, it gives a strong base for what they're seeing.
Okay, that makes sense. So with that huge data set as context, let's focus on Dr. Murami's main claim. What exactly did he say about these vaccine doses?
Well, his central point, and this is quoted in the material, it's pretty stark. He says, the more doses you get, the sooner you're likely to die within a shorter period. And he's specifically talking about the COVID mRNA vaccine doses here.
Right. And what's really striking is the timing the data seems to point to.
Exactly. The data apparently shows these significant peaks in excess deaths popping up, particularly between 90 and 120 days post-vaccination.
So 3 to 4 months later.
Yeah. So it's not an immediate thing. It's a delayed pattern they're reporting.
Okay, let's dig into something else they observed. This dose-response relationship. The source suggests that with more doses, the death peak shows up faster. Can you explain that a bit more?
Sure. So, for example, they're saying if someone had, say, 3 doses, the peak in excess deaths might show up around 120 days later. But with 4 or maybe 5 doses, that peak could apparently come earlier, maybe around the 90-day mark. Dr. Murami's interpretation is that this suggests toxicity accumulates, like repeated doses might speed up or intensify whatever effect they're observing.
Yeah, Dr. Murami seems quite clear on causality here. What's his reasoning for suggesting a direct link?
He argues pretty directly, saying that if the vaccine wasn't toxic or didn't cause death, well, there wouldn't be a peak. So for him, seeing these distinct peaks, especially varying with the number of doses, is presented as evidence of a cause and effect relationship within this specific data set.
And this finding really does stand out when you compare it to the more commonly discussed immediate side effects, right? Like many people know about myocarditis risk, which usually happens very soon after the shot, like within a day or a week. We're talking a different league here, time-wise.
Totally different. And a key point raised in the source is that doctors might not typically connect a death happening, 3 or 4 months after vaccination to the vaccine, because it's not immediately obvious, is it? They might miss this longer-term pattern entirely. It sort of fundamentally changes how you might think about tracking health outcomes after vaccination, looking way beyond just the first few weeks.
The source also brings up comparisons, looking at vaccinated versus unvaccinated groups in terms of excess deaths. What did that show, according to them?
Right. The source points to what they call clear differences. It suggests the unvaccinated group's excess deaths stayed lower over time. Reportedly, there was no peak forming in that group, which they describe as the expected pattern, basically the baseline.
Okay, and in contrast, the vaccinated group,
That's where the divergence is highlighted. Excess deaths in the vaccinated group are presented as being about 4.5 times higher than the unvaccinated group. And that's based on a linear scale, meaning it's presented as a direct proportional difference. So quite a significant gap according to this data.
And was this a short-term thing, or does it last?
Well, the source claims these excess deaths in the vaccinated group kept going for basically a whole year, with the really significant effects apparently seen for the first 240 days. That's almost 8 months. So, yeah, a sustained pattern, not just a quick blip.
Wow. Okay, so these findings from Japan, they naturally raise big questions for health regulators everywhere, don't they? What's happened in Japan itself in response? And what might this imply for other places?
Well, first off, these findings seem to align with some other research emerging. Professor Robert Clancy, for instance, is mentioned as reviewing an Australian statistician's work. That work also apparently shows excess deaths around 3 months post-vaccination, so there might be some consistency building there. And in terms of official response in Japan, this information has been sent to the Japanese regulators. And maybe more significantly, the Japanese government has actually made payouts compensation for over 8,400 injured people. That includes 93 deaths where they've acknowledged vaccine-related harm. So that's moving beyond just data into actual government action.
That's quite something. And it really throws a spotlight on data transparency globally, doesn't it? Japan is described in the source as having greater openness. They contrast it with the UK, for example, where apparently data comparing vaccinated and unvaccinated death rates isn't released. The reason given is confidentiality, which the source pretty strongly calls outrageous censorship.
Yeah, it really forces you to think about the global picture. If similar data exists elsewhere but isn't shared, well, what does that mean for public understanding and trust? Given the sheer size of this Japanese data set, 18 million people, and the patterns they're reporting, it does present a compelling case for regulators worldwide to at least examine, even if it hasn't gone through the traditional full peer review publication process yet. The scale makes it hard to just ignore.
So let's try and pull this together. What we've got is Japanese data covering a massive 18 million people, indicating these, well, alarming and pretty convincing differences, according to the source, in excess deaths between vaccinated and unvaccinated groups. And the key thing seemed to be these dose-dependent peaks appearing several months later, and this really underscores how vital open access to comprehensive, unbiased data actually is for understanding public health.
Absolutely. And maybe here's something for you to think about. We live in an age absolutely flooded with information, right? So how do findings like these, which come from huge population data but maybe haven't followed the standard academic publishing path yet, how do they challenge our usual ways of judging scientific claims? And what does it mean for keeping public trust when data emerges this way? It's definitely something to mull over as you navigate this complex information landscape out there.